Schizophrenia. Breaking the stigma. Schizophrenia, a term that sparks fear, misunderstanding, and curiosity. But what is it really? Let's take a closer look at this often misunderstood condition, uncovering the facts, challenges, and hopes surrounding it. What is schizophrenia? Schizophrenia is a chronic mental health disorder that affects how a person thinks, feels, and behaves. It's not about having a split personality, a common myth, but rather about experiencing disruptions in reality, emotions, and cognition. Key symptoms of schizophrenia. Schizophrenia symptoms are generally divided into three categories: positive, negative, and cognitive. Positive symptoms, added experiences. 1. Hallucinations. Hearing, seeing, or feeling things that aren't there. 1. The most common are auditory hallucinations, like hearing voices. 2. Delusions. Strong beliefs that don't align with reality, such as paranoia, believing someone is watching or harming them, or grandiosity, thinking they have superhuman abilities. 3. Disorganized speech. Talking in ways that are hard to follow, jumping from one idea to another without a clear connection. 4. Disorganized or catatonic behavior. Difficulty organizing daily activities or showing unusual movements and behaviors. Negative symptoms, loss of normal functioning. 1. Emotional flatness. Reduced ability to express emotions. 2. Social withdrawal. Difficulty forming or maintaining relationships. 3. Lack of motivation. Struggling with initiating or completing tasks. 4. Reduced speech. Talking less than usual, with minimal responses. Cognitive symptoms, thinking and memory issues. 1. Trouble with attention, memory, and decision-making. 2. Difficulty understanding information or organizing thoughts. How common is schizophrenia? Schizophrenia affects about 1 in 300 people worldwide. It typically appears in late adolescence to early adulthood, with men showing symptoms earlier, late teens to early 20s, than women, late 20s to early 30s. What causes schizophrenia? The exact cause of schizophrenia isn't fully understood, but it's believed to result from a combination of genetic, biological, and environmental factors. 1. Genetics. A family history of schizophrenia increases the risk, but it doesn't guarantee that someone will develop it. 2. Brain chemistry and structure. Differences in brain chemicals like dopamine and glutamate, as well as structural abnormalities, are often associated with the disorder. 3. Environmental triggers. Factors such as prenatal exposure to infections, malnutrition, or extreme stress during childhood or adolescence can contribute. 4. Drug use. Substance abuse, especially of marijuana or hallucinogens, may increase the risk or trigger symptoms in vulnerable individuals. Living with schizophrenia. Challenges and misconceptions. Schizophrenia is more than just its symptoms. It's a deeply personal experience, often shaped by stigma and misunderstanding. 1. Stigma. Many people associate schizophrenia with violence, even though most individuals with schizophrenia are not dangerous and are more likely to be victims of violence. 2. Loneliness. The disorder can lead to isolation due to social withdrawal or fear of judgment. 3. Employment and independence. Many individuals face challenges in maintaining jobs or living independently, not because they're incapable but because they lack the right support. Schizophrenia and creativity. Did you know that some of history's most creative minds are thought to have experienced schizophrenia? Vincent van Gogh, for instance, is often speculated to have lived with symptoms of psychosis. While schizophrenia can bring challenges, it can also offer unique perspectives on the world. How is schizophrenia diagnosed? Schizophrenia is diagnosed through a combination of 1. Clinical interviews. Psychiatrists assess symptoms, duration, and how they impact daily life. 2. Medical tests. Blood tests and brain scans rule out other conditions, like brain tumors or substance abuse, that might mimic symptoms. 3. Observation over time. Symptoms must persist for 6 months or more for a diagnosis to be made. Can schizophrenia be treated? Yes, schizophrenia is treatable. While there's no cure, early and consistent treatment can help individuals lead fulfilling lives. Medications. 1. Antipsychotics are the main treatment, helping reduce symptoms like hallucinations and delusions. Therapies. 1. Cognitive behavioral therapy, CBT, helps individuals manage symptoms and challenge distorted thoughts. 2. Family therapy, supports families in understanding and aiding their loved ones. 3. Social skills training, improves communication and daily functioning. Lifestyle and support. 1. Regular exercise, a healthy diet, and strong social connections can greatly improve quality of life. 2. Peer support groups provide a safe space to share experiences and build resilience. The reality of recovery doesn't always mean the absence of symptoms. It means learning to live with the condition, finding joy, and pursuing personal goals despite challenges. Debunking myths about schizophrenia. Myth: people with schizophrenia have a split personality. Truth: schizophrenia is about distorted perception of reality, not multiple personalities. Myth: schizophrenia is untreatable. Truth: with the right treatment, many individuals lead productive, meaningful lives. Myth: all people with schizophrenia are violent. Truth: most are non-violent and are more likely to harm themselves than others. Famous figures with schizophrenia. Did you know John Nash, the brilliant mathematician whose life inspired the film A Beautiful Mind, lived with schizophrenia? His story is a testament to the resilience of the human spirit. The importance of understanding and support. Schizophrenia isn't a life sentence. It's a condition that requires understanding, compassion, and the right care. If you know someone living with schizophrenia, be their ally. Offer kindness, patience, and support. Final thought: schizophrenia is a condition, not an identity. Behind the symptoms is a person with dreams, strengths, and a unique story to tell. Together, we can break the stigma and create a world that embraces all minds. Let me know what part of this resonates with you, and don't forget to share your thoughts or questions in the comments. Remember, education is the first step toward empathy.